My name is Dr. Vyas, and I'm a plastic surgeon at Breast Surgery Group. Gender-affirming top surgery or chest masculinizing breast reduction surgery for gender affirmation. So there are a lot of misconceptions, myths, misinformation, and misguidance that's out there. So we're here today to clear up a lot of that information. Myth number one is that the surgery is pain-free. So it's not a pain-free surgery. You'll have discomfort in the upper chest specifically. The incisions may feel like you have a paper cut. It will feel tight and a little bit uncomfortable, like you've ran a marathon, like you've done some bench presses, but overall pain is very well controlled. We have a very special protocol where we inject the ribs with a special long-acting nerve medication that helps with pain control for the first few days, in addition to some other techniques that we use, including no drains, which can also cause a lot of patient discomfort. Typically after surgery, 98% of patients only need Tylenol and ibuprofen if tolerated. So it's not a very painful procedure, but with anything, there is a recovery phase. Another myth is that the scar will disappear completely. So scars are forever. They never go away completely, but they do improve with time typically. And so these scars tend to be very long. Sometimes they can cross the midline in the chest and they extend very far on the side for gender-affirming top surgery. And so with scar maturation, which can occur over the course of about a year, most of the changes really come down to your genetics. And so some people, have bad scarring, some have genetically favorable scarring, 2, staying out of the sun, and then 3, there's some modalities that we can offer that can actually help improve the scar, but they don't disappear completely. Another myth is that you don't need breast screening after surgery. So while the majority of the breast tissue is removed during top surgery, that doesn't mean that 100% of the breast tissue is removed. And this is an evolving field that we've been doing a lot of research in as well. And really it comes down to you still need breast cancer screening and surveillance over time. You have to let your providers know in the future, whether that's your primary care or breast specialist, that I still have breast tissue under my skin and it still needs monitoring. Now those guidelines are subject to change and will continue to evolve as more evidence-based guidelines evolve. But it is an important thing to, continue to be involved in that conversation with your providers to make sure that they know you still have breast tissue under the skin. It's not 100% gone. Another myth that we commonly bust is whether insurance will cover my top surgery. Insurance will cover top surgery depending on your plan. Top surgery has a broad definition. For some patients, it means a chest masculinizing top surgery where we want to remove the feminine characteristics of the breast and achieve a flatter contour. There's a large variety in what constitutes top surgery. Sometimes that means a radical breast reduction from a large breast to a small breast. Sometimes that means going completely flat. Some patients want to preserve their nipples, some don't. Some want to preserve nipple sensation, and some don't find that as important. So there are a few elements of navigating the insurance process, but we're here to help you with that.